Namaste. My name is Chandra-Mouli. I worked for the World Health Organization from 1993 to 2023. For over 27 of these 30 years, I worked on adolescent health. I retired from WHO in August 2023. Since then, I continue to work on adolescent health with a particular focus on adolescent sexual and reproductive health and rights. I continue to learn, to communicate my learning in a variety of ways, to advise, to teach, and to support research, advocacy, and action. In May 2024, I was awarded a Doctor of Philosophy degree, a PhD degree, by the University of Ghent, Belgium, at the ripe old age of 65. Nearly 45 years after I completed my undergraduate medical education. My PhD was on scaling up, sustaining, and enhancing school-based sexuality education in resource-constrained and conservative contexts, replicable lessons from positive deviant countries. Here is my rationale for the PhD. Policies on school-based sexuality education program are there in many places, but there's a huge gap between the words on paper in terms of policies and action on the ground. We have a good understanding of the factors that hinder the provision of school-based sexuality education. But we have very little knowledge and understanding of how a small number of countries have broken the mold and actually gone ahead and scaled up, sustained, and enhanced their school-based sexuality education programs. That is the gap I sought to address in my PhD. The objectives of my PhD were to identify low and middle income countries that had scaled up, sustained, and enhanced their school-based sexuality education programs, and to identify the factors that enabled them to do this when so many other countries around them in similar circumstances were unable to do so. In terms of methods, I identified candidate case studies through reading articles and journals and newsletters, participating in conferences and seminars, and meeting and talking to people working in this area. I shortlisted the candidate case studies using a validated checklist. I then developed 6 individual case studies using 3 validated analytic frameworks. And once these 6 case studies were there, I distilled them and then drew out the lessons, both common lessons as well as specific lessons. I have grouped the findings into 5 areas. Firstly, we identified countries that had scaled up their school-based sexuality education programs nationwide or in parts of their countries. Each of these programs had been in place for more than 3 years. Each of them had demonstrated results in terms of programmatic outputs or in terms of individual outcomes. So there were tangible results that we could speak to. I included 6 case studies in my PhD, but that does not mean that there are only 6 countries which have scaled up their programs. There are others, but I have only included 6 of them here. 2 from each continent in 3 different parts of the world. Secondly, we identified the factors that these countries used to place nationwide scale-up of sexuality education on their political and governmental agendas. This included direct transnational influence from the outside, domestic advocacy, and in some cases, using political windows of opportunities if they arose. Nigeria provides an excellent example of joint and sustained advocacy to develop a policy and strategy to scale up family life and HIV education in this large and diverse country. Thirdly, we identified the factors that enable these countries to implement their policies and to scale up, sustain, and enhance their school-based sexuality education programs. They planned scale-up meticulously, they managed it actively and energetically, and they used data and implementation experiences to shape and reshape their programs. A number of examples. Uruguay is an excellent example of meticulous planning from the national to the local levels. Jharkhand state of India is an excellent example of government NGO partnership in managing implementation and dealing with challenges as and when they arose. Jharkhand state India is an example also of using data to enhance programs. They used evaluation data carried out in successive years to convince the government to take the sexuality education program to younger age groups and to strengthen the content of the sexuality education program, both for the younger age groups and for the older age groups. Fourthly, we identified the factors that enable these countries to sustain their sexuality education programs. A key approach was to link both planning and management with existing policies, strategies, plans, budgets, and most importantly, delivery mechanisms. Mexico provides an excellent example of this. Its national school-based sexuality education program is decades old. It has evolved in terms of its name, its content, its structure. But through these changes, the program has remained firmly grounded in the government, though NGOs have played complementary roles. Fifthly and lastly, we identified the factors that enable these countries to build support and overcome resistance to sexuality education. To build support, they worked hard to build concurrence, tolerance, acceptance, making compromises when they needed to do so. And to build support, they also reached to stakeholders in the middle, not strong supporters nor strong opponents, the middle, and they worked to expand the middle, to get support from the middle. In terms of resistance, they learned to understand who the players were, what their thoughts and feelings were, where they were coming from, and to anticipate and respond to resistance effectively and in a collective manner. Pakistan and Senegal, in two different parts of the world, provide wonderful examples of the use of complementary approaches to build support in different contexts and to overcome different kinds of resistance in two different contexts. They provide useful examples for us to emulate. To conclude, the countries we studied did a number of things together. This included placing scale-up of sexuality education on the national agenda, planning scale-up meticulously, securing funding from within the country or outside, and managing scale-up actively, using data and implementation experiences to shape programs, promoting and safeguarding sustainability, deepening and extending support, and anticipating and responding to resistance energetically when it arose. The approaches they used were not new. They were largely old ones. What they did was they brought these approaches together, tweaked them when they needed to, and then put them in place doggedly and achieved the results that so many others around them did not. By doing so, what they were positive deviants. They achieved results that organizations, countries in similar circumstances could not or did not. Doing my PhD was an enormous learning experience, an enriching experience. I would strongly recommend it. Using the opportunity of my PhD to bring over 10 years of learning that I've done with colleagues and collaborators from so many countries around the world, distilling this learning and then placing it in the public arena in order to strengthen programs around the world to meet the needs and fulfill the rights of children and adolescents has been a real privilege. I feel blessed on both counts. Namaste and thank you.